Hey guys, welcome to another episode of The Controversial Truth. This is our TG Wellbeing series. I am Dr. Victoria Munoz. This is Adam Santos,
What's up,
and
everybody?
we've got some really good stuff for you today, all things testosterone.
Yes. Well, I'm excited for this again. We had an awesome conversation last week and got a lot of good questions answered, a lot of information as always. But to kick it off today, there's all types of testosterone out there. There's certain types, cypionate, enanthate, all that. But in terms of the testosterone, is there more than one type that can be used for therapeutic usage?
Yeah, so there are basically three general types of testosterone that are used clinically. The testosterone propionate, now that's a more fast-acting testosterone, and it has a half-life of about 20 hours. It's typically used with performance athletes. They use it, they might inject it right before they do legs, for example, to get growth in their legs. Therapeutically, we can use it in a mixture with other types of testosterone, like medium-acting and long-acting, to get a more sustained result with patients. But for the most part, it's not really used clinically on its own. And then we have the enanthate, testosterone enanthate. And the second word on the testosterone, like enanthate, propionate, cypionate, that's the ester that's attached to the testosterone molecule. So basically what the ester is once the testosterone is injected, the ester breaks off, and then the testosterone becomes active at that point. And depending on what ester is attached to it determines the half-life of the testosterone. So like I said, the propionate has about a 20-hour half-life. The testosterone enanthate has about a 4.5 to 5 day half-life. So it's a longer acting testosterone. And physicians will sometimes use this mixed with the faster acting to get a more sustained result. And then there's a cypionate, which is what I use clinically. It has about a 2-day half-life, and it works beautifully because you really only have to inject it once a week. The beauty of it is that if for some reason the testosterone levels go higher than we want them, it doesn't take as long for it to come back down into normal range. So I like the cypionate. It's bioidentical to what our bodies produce naturally, and it just gives a really good sustained result. I will, if I need to, use a faster acting or a longer acting with it, but it's rare that I have to do that.
Interesting. And why would you say you prefer the cypionate over propionate or enanthate per se?
It gives the right amount of effect in terms of injecting it once a week. Like with the enanthate, for example, you could just inject that possibly once every 4 weeks. But then if you think about it, if the patient's having side effects for some reason, or if their levels have gone too high, it takes that much longer for it to come down. And we don't want that, because especially like with females, side effects from testosterone overdose is absolutely permanent. And so it's very important that we monitor it closely, we give the right type of testosterone, and that we give it in the right amounts.
Interesting. And obviously, like you're mentioning, there are side effects of too much testosterone in the body. But for men and women, what are the side effects of low testosterone?
Yeah, low testosterone is very disheartening for most people.
Yeah.
A lot of the symptoms might be very generalized, and they might not know what to relate it to. For example, fatigue, brain fog, just difficulty concentrating, difficulty sleeping can be a part of that. Sarcopenia, which is loss of muscle mass. And then what happens is they start gaining the weight around the middle, and they start accumulating more visceral fat in their abdomen, which is highly inflammatory and just a metabolic disaster for disease. And low sex drive, there's a lot of generalized things that both sexes experience. However, with men, they might not notice it as much. With women, though, they might start having some virilization, like maybe some growth of facial hair, enlargement of the clitoris, which can be permanent if it's not caught right away, and change of the voice. Even alopecia, hair loss related to high doses of testosterone, women could experience that as well.
Interesting. And so you kind of mentioned, it could be irreversible for women. Is that the same for men, or is it more so the female side of
It's
things?
more women, because testosterone in high amounts causes these male pattern characteristics, which men already have.
Yeah.
So it's not really going to affect them that way.
Interesting.
Even though we don't want them having doses too high, because it could cause the hematocrit to go out of range, and then the thickening of the blood, which can be remedied by giving blood donation every 4 weeks. But you really don't have to do that if you monitor it closely and you give it in the right amounts, and you monitor the labs.
Yeah. Oh, very, very fascinating. So it sounds like then testosterone is going to work a little differently in men than women. I mean,
for the most part, yeah. I mean, testosterone is known as a male hormone, even though women need it too. And women need it. It's important for the development of the ovaries, for sex drive, for bone density and bone health. When your testosterone goes down and when you start experiencing low levels of this hormone, you're more prone to osteoporosis later in life. And that's something that we definitely don't want people experiencing, because fracturing bones is, it's a death sentence.
Absolutely. And then, so, obviously testosterone is going to be important for both men and women, but what about DHT? What is that exactly, and what does it do inside the body?
Yeah, so DHT is very interesting. It's a metabolite of testosterone, and men need it during puberty and in early young adulthood. After that, it doesn't really serve a purpose, and about 10% of men's testosterone is DHT early in life. Now, what can happen is, as men age and they become metabolically unhealthy, which is most people, it's estimated that 94% of Americans have some form of metabolic dysfunction.
Interesting.
It's a lot.
Yeah.
And so, again, what we're seeing is normal aging is not normal.
Yeah.
But as testosterone goes down, the DHT can rise, just like the estrogen.
Yeah.
The estradiol. So we want to avoid that as much as possible. There's ways to address it, and we're going to go a little bit more into that as we move through this podcast. But
absolutely.
But we can give finasteride in a very low dose. There are side effects to finasteride, but it's really dose related, because what it does is it kind of suppresses testosterone production. It's often given for men who are losing their hair, and it has to do with the excess production of DHT. It can reduce your DHT production by 70%, the finasteride. So it can be a good drug to give if it's necessary, but we can do lifestyle changes and address it by improving metabolic health.
Yeah.
Way better than having to give a medication.
Interesting. Very fascinating.
Yeah.
It's crazy how all the hormones and everything, work.
They all work together like a symphony, and if you're not addressing all of them, then you're not really bringing yourself into optimization.
Yeah. And with that, bringing it into optimization, is there any lifestyle changes that can be taken or implemented to help naturally, increase testosterone and normalize the hormones in the body?
Yeah, so that's a really good question, because I highly recommend lifestyle improvements along with TRT. The thing is that men's testosterone starts to decline by 1% to 2% starting at the age of 25. So it's a very gradual process. And then, of course, by the time they're 40, they really start noticing the symptoms. So the way you can mitigate that and even slow it is by eating a meat, animal-based diet. Carnivore's best, but at least 80% carnivore, with the red meat and saturated fat. That's really going to help boost your cholesterol levels and bring your triglyceride levels down. That's what we want. We want high cholesterol. We want low triglycerides. That is a perfect picture of health right there. And then with that, because cholesterol is at the top of the pathway, the production of our sex hormones, that we are able to sustain our testosterone levels at an optimal level longer in life. And, maybe by the time you're 100, you might need a little TRT, but why are we seeing men need this at such an early age? It's because they're so metabolically sick by the time they're having symptoms. And like I've said in previous episodes, we can possibly completely reverse it, but not always. And once damage is done to the mitochondria of the cell, which is the powerhouse of the cells and organelle, It's inside every cell of our body. Depending on how metabolically active the cell is will depend on how many mitochondria we have in that cell. You know, like nerve cells have thousands of mitochondria in one cell. So that's telling you a lot about the importance of the mitochondria. Well, all disease is related to dysfunction of the mitochondria or some kind of damage to the mitochondria. It's a pretty tough little organelle. So once it's damaged, you know that we've been not doing ourselves any favors. And a lot of it's diet. It's the majority of it. Probably I would say, to be conservative, 80% of the reason we're experiencing metabolic dysfunction is because of the foods we eat. There's not a single essential carbohydrate for the human body, not one. We can produce any glucose that we need through a process called gluconeogenesis from the liver. And what the liver does is it takes the proteins that are stored that weren't used and breaks off the little amino group and releases it into the blood as glucose for what's required for life. Certain cells require it. Brain cells work really well on ketones, but there are some areas of the brain that require glucose. And then muscles need about 30%. Red blood cells are obligate glucose metabolizers. They can't metabolize fatty acids. So the body knows what to do on its own with a proper diet. So that's the first thing, to help to optimize our hormones naturally. Getting good sleep is huge. Our human growth hormone is produced during sleep, and it does decline over time, but the level of decline that we're seeing is more than what it should be at earlier and earlier ages. So sleep is really important. Human growth hormone is the king of all hormones, the master hormone. So if it's not running well, then of course everything down the pathway is going to suffer, right? Because we talked about how addressing hormones on the front end can affect everything down the stream, right? So that's essentially what we want to do. Is we want to optimize the key players, one of them being testosterone. Testosterone is a highly desired hormone.
Absolutely.
And people want this, but they don't know how to find it. They don't know how to find the right doctor, or even a doctor that would prescribe it. That's another topic for another time. A lot of doctors out there that men will come in their 40s and 50s and their testosterone is 300 something. And they say, well, your testosterone's fine. And that's, maybe it's okay for what you see in this day and age for that age. But it's not normal, first of all. It's a sign and a symptom of a disease process. And that's why these people don't feel good. So then we get these people from these other clinics coming to me. I get probably 50% of the patients I see for hormone replacement come from other doctors because they're not feeling good. And then I look at their numbers, I say, this isn't okay. And what are you on? And why are they doing that? And on and on and on. You know, and then we get them optimized and they feel a lot better.
No, absolutely. And why do you think it is then that other facilities or other doctors are just trying to get them into the normal range for their age versus optimizing like you do?
They're not taught. They don't know anything about metabolic health. MDs know nothing about metabolic health. They have one very weak term of biochemistry in medical school, and that's it. It doesn't teach them anything about anything. I use biochemistry every day in my practice. If I'm going to optimize people's health, if I'm going to reverse aging and disease, then I have to understand biochemistry. And you saw this, I have this map of these pathways. They're just, you look at it and just make your brain hurt. You know, and I'm using that every day with patients to make sure that they get the best health outcome for what they deserve.
No, very fascinating. And then, so, you know, I've seen a lot of online, social media, natural test boosters, over-the-counter testosterone boosters. Are those effective? Do those work? Or do they do anything at all?
Well, let me tell you.
Glasses off.
Glasses off. Now we're rolling up our sleeves, getting serious. I get a lot of men coming in for their initial visit on test boosters because they don't feel good. They know that they're tired halfway through the day. Sometimes they wake up tired. They don't sleep good. They can't get gains in the gym. Their libido's in the tank, and they're trying to help themselves. I understand that. Except that the problem is that they don't work. And when I look at their blood work, I say, how long have you been on this test booster? Oh yeah, you know, about 6 months. I said, look at your testosterone. it's 200 something.
Yeah.
So it's not boosting your testosterone. What it's doing is it's damaging you metabolically. And I've read some of the advertisements for these test boosters, and they sound very promising.
Yeah.
They're not. Why would you want to do that over doing a testosterone replacement therapy with a doctor who knows what they're doing, understands metabolic health, knows how to modulate and optimize hormones and get you in the best state of health?
Yeah. Yeah.
You know, and sometimes they don't question doing that, but then when I present to them, yeah, I think you need TRT, and this is what we do, I'll explain how it works and what we're doing with the testosterone. Then all of a sudden they become researchers.
Yep.
They didn't think twice about taking that test booster because it's natural. It's not natural. It's nothing. I don't even recommend taking a supplement without clinical findings, because it's no different than just doing this.
Yeah.
You know, I'm going to take a test booster because I'm tired and I can't make it through the day and I can't get through my workouts. No, that's not the solution.
Yeah.
The solution is replacing your testosterone that you're not producing with a pharmaceutical grade testosterone that's going to do the job, that's monitored by a doctor who's seeing your labs every 12 weeks, making sure you stay optimized.
Yeah.
These are the patients that get the best results without the side effects.
Yep.
Yeah, the side effects are huge. When it's not uncommon, doctors will put patients on a testosterone, even an injectable, and won't see them for a year.
Wow.
How do you know what it's doing?
Exactly.
And then I've seen these patients in clinic, and they are feeling horrible. It's either way too low, way too high. They're having some side effects from the treatment, and I say, no. The DEA monitors testosterone prescribing very closely. It is a controlled substance. I, as a doctor, take it very seriously. And when patients come to me, they keep their appointments, they inject the exact amount that I say to inject, or they're not a patient anymore. Yeah. So we're very diligent with our treatment. We're very precise, and we get really good results.
Yeah, absolutely. And then just a follow-up question on that. I know in conversing with people, oftentimes what some people find nice about the natural or over-the-counter test boosters is it's a capsule, it's oral, and it's not injectable. Is there any type of like testosterone cypionate that is oral or not injectable, or is injectable the only way to go about it?
Here's the thing. There is one form of testosterone. I can't even pronounce it because I've never saw it until recently. I was reading about different testosterones and what are used therapeutically, because I wanted to know if there's more than just the three. There's another one. I mean, there's more than that. I wouldn't even be able to pronounce it, but it was started in China as an injectable. And then in the European Union in the 1970s created an oral. I don't know if it's a capsule or a troche. And it's not really used today. I haven't seen it. Well, not in the US anyway. It might be used overseas, but really intramuscular or subcutaneous injections are the best. I do more subcu with women because the dose is so small. With the men, it's at least a half cc, so that really needs to go into the muscle. But that's the way we get the best result. We definitely don't do topical with men, because what happens is what converts testosterone into DHT is 5-alpha reductase. It's an enzyme, and it's in high quantities on the skin. And so when men do a topical testosterone, they tend to convert to DHT more easily. So the injectable is really the best. Now, caveat is to prevent the conversion into DHT or estradiol is low and slow. We start hormones at a low dose and we titrate up.
Makes sense.
Every 12 weeks. And that's the way that we can mitigate at least the majority of it. I haven't had men really with any problems with DHT production as a result of the TRT. Some doctors do, but it's my suspicion they're probably not doing it right. They're saying, here's your prescription, see you later. And they're giving them the maximum dose of what they can have. That's what's causing the not only aromatization at high levels, but also the production of DHT.
Awesome.
And DHT, as you may know, hair loss, benign prostate hypertrophy. Now, it doesn't cause cancer. here's the thing about cancer and prostate cancer. You do see higher levels of testosterone with prostate cancer, but it's opposite of what we think. What happens is the prostate cancer actually causes an increase in production of testosterone, which causes the production of DHT. So by the time the patient gets to the doctor and they see these high levels of testosterone, they think that the testosterone caused the cancer. And that's where that misconception comes from.
Yeah.
It's actually the cancer causing the increase in testosterone.
Yeah.
Just like last week, we talked about how PCOS, the polycystic ovarian syndrome, causes an increase in production of testosterone in women. Well, it's because the ovaries are responsible for the production of testosterone in women. When the cysts start growing on the ovaries, then we have high testosterone production.
Yeah.
Also, the adrenals are also responsible for testosterone production in women. So after menopause, the adrenals kind of take over that role, even though it's not as good as both players together.
Yeah.
And that's why after menopause, testosterone replacement is definitely indicated for women too.
Yeah, makes sense. Well, it's really, it's really awesome about everything that you shared. Is just the knowledge that you have. I've been to other TRT clinics. I never got any information. It was, here's your labs. This is what you need. Here you go. See you in 12 weeks.
Yeah. I'm a big proponent of teaching patients.
Yeah.
That's why our new patient visit is 30 minutes.
Yep.
And they actually meet with me, not an MA or, a nurse. I'm not saying that those professions are not admirable.
Yep.
It's just that they're not the ones that should be talking to patients about their TRT.
Yeah. Yeah.
And so I sit down, I give them at least as much science as I can in 30 minutes.
Yep.
And teach them the indications,
Yeah.
How to avoid side effects. And I have not had a single side effect with a single patient as a result of monitoring their labs closely, giving it in the right amounts, and checking in.
Yeah, that's amazing. I think that's what people are typically scared of, is the side effects. The questions I'm always getting asked, well, what about the side effects?
Right.
What side effects can I expect? They're already projecting that they're going to have side effects, but when you have somebody knowledgeable like yourself who educates and really makes sure that you understand and you care about the patient, you can really eliminate the side effects pretty much altogether. That's what it sounds like.
Yeah. In all the years I've been doing this, I haven't had a single side effect related to TRT. Men, sometimes I have to put them on an aromatase inhibitor.
Yeah.
It's a pretty benign drug.
Yep.
Everything could have a side effect. Walking across the street, you could have a side effect, right?
Yep.
If you don't look both ways,
Yeah.
but if you look both ways, you should be safe.
Yep.
So that's pretty much like prescribing hormones.
Yeah.
As long as you're doing it correctly, the patient's going to be safe. I have to always tell them these are the possibilities of side effects, but then I always tell them, as long as it's done right, you work with me, chances are you're not going to have any.
That's awesome. That's amazing. Well, Dr. Victoria, always a pleasure, always so informative. I always get information out of this. I feel like I'm back in school. So I appreciate
Me too.
I know. I bet.
I love talking about this stuff.
Yeah. Well, I really appreciate you sharing your knowledge and expertise in this. And to everybody out there, you definitely got to come see her. She knows what she's doing. Again, thank you, Dr. Victoria.
Definitely.
Yeah.
I'm happy to be here. And hey guys, thanks for joining us for another episode of our TG Wellbeing series. I'm Dr. Victoria Munoz. This is Adam Santos, and see you next time.
Boom.
Boom.
There it is.